Let's say that you go to a locked kitchen. In the locked kitchen, which is totally burned, you find a dead body which is totally burned, totally charred. Look at this dead body. It's totally burned, totally charred. The attitude is that of a boxer. The arms are flexed, and on the skin there are linear splits resembling the wounds of a knife. Now the main question comes is that is this murder or accident, or is this suicide? We will find that out in today's video. In today's video, we will not only study burns, thermal injury in a clinical manner, but we will also break it down forensically. So stay tuned. Now let me tell you what you will be learning by the end of this video, or if this comes out to be a two-part video, by the end of the two-part video you will be able to tell the classification of thermal injuries. You will know what exactly do you mean by Jackson zones and the importance of Jackson zones. This is very important. And then you will be able to estimate what is total burn surface area, TBSA, and you will learn how to calculate TBSA. Then you will be able to differentiate between burns and scalds and classifying burn depth, as well as most important, what you will learn is how to differentiate between antemortem burns and postmortem burns. What most people think is that thermal injuries are just injuries due to exposure to heat, but that's not always true. Thermal injuries also include injuries which are due to exposure to cold. This is very important. Okay, so classification of thermal injuries begin with injuries due to heat and injuries due to cold. Let me explain you the classification in a much simplistic way. Now, thermal injuries can be, like I said, due to cold or due to heat. So thermal injuries due to heat and thermal injuries due to cold. Now, in both of these, it can be due to localized exposure or generalized exposure. First, thermal injury due to generalized cold exposure, which is called as hypothermia. Then could be cold injury due to localized cold exposure. Same goes for injuries due to heat exposure. Okay, heat exposure could be either generalized or localized. When it's generalized, we use the term hyperthermia. Now, further dividing this, hypothermia can be mild, moderate, or severe. Now, if we divide localized cold injuries on the basis of severity from the least severe to the most severe, the classification goes something like the least severe condition is called as chilblains. Chilblains. Then comes your trench foot. Trench foot is due to wet cold. And then frostbite. Each of this I'm going to discuss in detail. Okay, so don't worry. Right now I'm just teaching you the classification, how to memorize the classification. And then comes the hyperthermia and localized, further dividing localized heat exposure. If the heat is dry, then it's called as burns. Okay, if the heat is wet, by wet I mean it could be hot water, hot oil, anything like that, then we call it as scalds. Scalds. So this is how you should classify thermal injuries. This is simplistic classification. Everything else we'll do now in detail. Let's first start discussing the effects of cold on the body. Now, hypothermia, the term coined for generalized cold exposure, is hypothermia, and it is defined as when the core body temperature is below 35 degrees Celsius. What is the normal body temperature? It is 37. Okay, this is the 37, and in Fahrenheit, it is 98.6 Fahrenheit. Okay, Fahrenheit, or whatever the pronunciation may be. Anyways, but this is, and even this is in a range. Okay, so when it goes below 35, When it goes below 35, we call it hypothermia, and we break it down clinically into mild, moderate, or severe. And these are the various ranges. When we call it mild, when we call it moderate, when do we call it severe, there are these different temperature ranges. Now, these are basically numbers, okay? These are basically just numbers. No need to worry about them, or these are not that interesting. These are just facts. But what is interesting is how cold exposure changes the behavior of a person before death. That to me is very fascinating, and I will discuss it within a minute. Just give me a minute and I will discuss it. Coming to what are the causes of hypothermia. First is environmental hypothermia. It means that the environment itself is cold. Okay. Let's say the person goes to Arctic region or Antarctic region. The environment itself is cold, so the person is hypothermic. Second is immersion hypothermia, where the patient is immersed in cold water, okay, for a long period of time. This water may not be particularly very cold, but slightly below the body temperature. If the person remains immersed, okay, then it's called as immersion hypothermia. Third thing may be excessive heat loss from the cutaneous body surfaces, which happens in burns. Burns we are going to discuss in the next part of this video. And 10. What is 10? It is toxic epidermal necrolysis. Okay. So this comes in your pediatrics. Lastly, inadequate heat production due to drugs. What are the drugs? Most notorious one which I want every student to know is alcohol. Okay, alcohol is the most notorious drug. There are certain pathologies also. For example, I can give maybe hypothyroidism. Okay, hypothyroidism is one of those pathologies. So these are the causes of hypothermia. Okay, coming to the autopsy findings of hypothermia. Firstly, the most important finding is the pink lividity. What you see over here is pink lividity, and what I need you to remember and not confuse is that this pink lividity is due to oxyhemoglobin. It is not due to carbon monoxide. Not due to carbon monoxide, it is due to oxyhemoglobin. Why due to oxyhemoglobin? Because what happens in cold is that the hemoglobin in the tissues, at the level of the tissues, cannot leave the oxygen which it is carrying from the lungs. It's basically loses its capability to lose the oxygen. So O2 cannot be utilized in the cold tissues. Therefore, there is oxyhemoglobin, and this leads to a pink lividity. Most interesting thing is that there is paradoxical undressing. What we see is that there is a paradoxical undressing behavior. What happens is that there is vasodilation right before death because of all the oxyhemoglobin, and because of the cold, there is massive vasodilation. This leads to a sort of a hallucinated behavior where the person gets hallucinations of heat, and he does paradoxical undressing of himself. And this is one behavioral effect of extreme cold exposure in the terminal stages just before the patient dies of cold. Another such behavior is the hide and die phenomenon, which means that if a person is subjected to extreme cold and he is about to die from that cold, immediately before dying, he will have a burrowing behavior. He will go dig some hole, he will hide in some cave. That kind of a behavior is seen in such people, and then immediately after this behavior, generally these people cannot survive and they die. Last internal finding is, this is frequently tested in exams, is Wischnewski ulcers. What are these Wischnewski ulcers? They are small black brown, almost like these dots. They are small black brown erosions, okay, small erosions, punctate erosions, and they have a diagnostic value. Now let's discuss Wischnewski ulcer in a bit more detail. What you see over here, these small black dots, these punctate hemorrhages, these are Wischnewski ulcer. This is basically an image of the stomach. The stomach has been dissected and it's been removed from the body and turned inside out. So what you are seeing over here is the mucosa. The the innermost layer of the stomach, and on the mucosal wall you see the small dots, these hemorrhagic dots. Over here you can see, over here you can see, these are called as Wischnewski spots. Now, most important thing which I want you to remember is that just because you are seeing Wischnewski spots in autopsy, that doesn't mean that it is definitely a case of hypothermia. You should always see the corroborative, which means you should see the condition in which the body is found. For example, Wischnewski ulcer can also be seen in death due to fatal burns. They can be seen in deaths due to diabetic ketoacidosis. They can be seen in poisoning. They can be seen in alcoholism. What I like to teach is that these spots, they do not indicate anything particularly. They just indicate that before the patient has died, that the patient was subjected to significant metabolic stress immediately before dying. That is all we can say by seeing this. But if you see Wischnewski spots in a body which is found immersed in cold water, or if you see Wischnewski spots found in a particularly cold condition, then it holds some diagnostic value. Let's start with the localized effects of cold. Whenever cold exposure is at one particular body part or some body parts, what are the effects? Will go from least severity to most severity. The least severe one is called as Chilblains. Now, many of you might have seen this particular image of Chilblains, which this image which you are seeing. Uh, but what exactly is this and why does it happen? Chilblains, these are reddish lesions, as you can see, purple violaceous lesions. They are painful, but the funda behind which a student should know is why do they happen? See, they happen whenever there is mild exposure to cold. The cold is mild. By mild, I don't mean little bit mild. I mean which is non-freezing. Okay, not exactly freezing cold exposure, but little bit of cold exposure, and this is generally repeated and also persistent. Okay, whenever there is this, see what happens whenever there is exposure to cold. Your blood vessels, if there are blood vessels, I'll draw the blood vessels over here. If there are blood vessels, every time there is exposure to cold, the blood vessels are going to vasoconstrict. Okay, they are going to constrict, become smaller in size. They're going to have vasoconstriction. But if there is persistent, repeated exposure to mild cold, what is going to happen is inflammation of these blood vessels. Okay, so this is basically just a type of vasculitis. Okay, this is basically due to inflammation of the peripheral blood vessels. So therefore, chilblains are seen in the peripheral lesions at the fingertips, at the tip of the nose, at the tips of the ears. Okay, so this is what exactly is chilblains. Remember the pathophys behind it. It is repeated cold exposure, persistent cold exposure, causing repeated vasoconstriction that irritates the blood vessel, inflames the blood vessel. Okay, now I'll come to what is trench foot. Trench foot, also called as immersion foot, these are the pictures, and this is due to wet cold exposure. What do I mean by wet cold? It means that suppose if the suppose if the foot stays immersed in the water, now that is called as wet cold exposure. Whenever there is wet cold exposure, it results in trench foot, and generally the temperature of the water is not freezing cold water, but not exactly it is ice. Remember this. Now we'll take it to a slightly higher degree, which is frostbite. First we did chilblains, then we did trench foot, which is somewhat more in severity. Now the most severe form, also called as freezing cold injury, frostbite. This happens when there is exposure at freezing temperatures, and the most important which separates it from trench foot is that it is exposure to dry cold. So whenever there is exposure to dry cold, what happens is there is ice crystal formation. Let's say that this is a blood vessel. Inside the blood vessel there is blood, nothing new about it. But when the body is subjected to freezing cold, there are ice crystal forming in the blood, in the tissues, and these ice crystals, they cause cell death, cell destruction, and even gangrene. So the limb, many times it cannot be even saved. It has to be amputated. And this happens only in grade 4 of frostbite. So there are 4 grades of frostbite, grade 1 to grade 4. But don't remember all that. What I want you to remember is that chilblains is basically inflammation, trench foot is due to wet cold exposure, and the wet cold exposure causes vasoconstriction, and that vasoconstriction not only inflames but a step higher, it causes endothelial damage. Okay, there is endothelial damage. And lastly, frostbite. Frostbite is due to dry cold. Okay, frostbite is due to dry cold, and this dry cold, there can be, in the last stage, there can even be gangrene, and there is ice crystal formation. Once again, I will discuss this once again in a very short manner. Basically, it's that dry cold freezes, wet cold rots, and mild cold inflames. Remember this. Always remember this. You will never confuse in exam. Dry cold freezes, wet cold rots, and mild cold inflames. When mild cold exposure called as chilblains, wet cold exposure called as trench foot, dry cold exposure called as frostbite. Lastly, if you want to take a screenshot of this, you can take a screenshot of this. It's a very good differentiation table that I have made. Okay, so that was our video on hypothermia. In the next part of this video, I'm going to discuss the effects of hyperthermia, or the effects of heat on the body. So make sure to watch even that. It's going to come out soon. Subscribe to Pursuit of Medicine. Stay connected. Happy studying.